Hi everyone, it's Dr. Marcus Chacos with E2 Chiropractic, how to escalate your development and elevate chiropractic. Today I want to talk to you about professional development. And this is a topic that really becomes the emphasis of most people's chiropractic professions. And if you're a student, then everything you are doing is professional development. It is the knowledge you are learning and the skills that you are developing. When you graduate, you're still expanding your professional development. Every time you're adjusting somebody, you're improving your skills, you're enhancing your technical ability to deliver that adjustment. You may be doing some reading or some learning, and you'll have to do CPD or continuing professional development. So all of this falls under the scope and category of professional development. And what I want to talk to you about in relation to this is understanding how professional development is in multiple categories and influences your entire professional career. So the first category of professional development are the skills that you have. So the skills that you have in taking a history, doing an examination, creating a differential diagnosis, delivering an adjustment. Most people talk about those skill sets, the knowledge base that informs your activities that produces specific skills and outcomes from those skills. Of course, your expertise in a particular area is a basis of your knowledge, your study, and your understanding of that information and its application within the clinical context. So, for example, you've gone to university, you've studied a lot, you know a lot of information. But have you read, say, for example, the foundation of chiropractic and really deepened your understanding of subluxations? Have you done additional study on measuring x-rays specific to be able to find out the scoliosis curves or the angle of the cervical lordosis and things like that? All of that is continuing professional development, and that professional development underlies your level of expertise. So what I wanted to talk about right here at the beginning is to understand that professional development is the foundation for what the success of your career will look like. So to put that in context, somebody who does a little bit of professional development will have a little bit of progress and develop a little bit of skill, knowledge and expertise, and maybe have a little bit of success in practice. A person who recognizes, knows, understands, implements and applies the principles of continual professional development soon masters their history taking an examination, masters their adjusting skills, and then also masters their ability to communicate, to educate. And the result of that mastery is incredible success and expertise as a result of the implementation of those processes. So I know that you understand this in principle, but I wanted to bring it to practice and to what it looks like. So the continuing professional development requirements are that you may, and every state will be different, every country will be different, but it may be that you only need to do 20 hours of continual professional development per year, and that you might do a skills course and then a risk assessment or risk management course, and that's all you need to do to cover your CPD hours for the year. So your professional development will be improved technical ability to adjust and more knowledge and understanding about how to mitigate or limit risk as a chiropractor, giving you a discount to your insurance costs. That doesn't make you a master practitioner. Professional development is what areas of expertise am I developing? Am I not only doing my history and my examination, am I adjusting development? Am I learning more about x-rays? Am I learning more about philosophy? Am I understanding more about the brain and studying neuroscience? How many books have I read? How many courses have I attended? How many videos have I watched? So what I want you to recognize is at uni, you are learning to be ready to practice. When you get into practice, that's your learner's permit, because you should be, in my opinion, under the guidance of a mentor to help you put in practice and put in play all of the things that you're about or that you have learned and are about to put into practice. So let me put that in the context of driving. When you sit in the car with your parents and you're on the side, you're learning all about driving. And if you're 15 or 16, they're preparing you in some way by having conversations about what driving is like, what you should be thinking about, how you should be aware of all of the peripheral things going on around you. Then you sit down and you start reading the book to see your L's. So that's a little bit like what you've done through your years of study, is getting ready to go into practice, which is behind the wheel. So once you pass your L's test, you get to go behind a wheel. But you get to go behind a wheel for a year with somebody sitting next to you, giving you insight into the driving skills that you haven't learned yet, their understanding of how the road works and all of those factors, because it's so different driving a car to being a passenger in a car, particularly when you're first learning. It's so different going into practice day one, taking everything that you've learned and putting it into clinical application, than it is learning it academically or theoretically. So you've now got your learner's permit when you graduate, and you have next to you the person mentoring you, teaching you, coaching you, supporting you, providing you the opportunity to put in place all of the knowledge, the theory, the education you've learned into that clinical setting. And then they give you feedback, just like when you're driving the car and you're like getting a little bit too close to the car and your parent grabs the steering wheel and pulls you back, you know, to that safe zone again. I'm sure we've all had that. I know I had that with my children. Hopefully your parents didn't scream. I didn't. I was just gently bringing them back. But what I'm saying, and again highlighting this point, is now that you're in practice, you've got your L's, you're out there on the road driving. But that doesn't mean you're a master practitioner. In fact, I know that you wouldn't expect that, and most of your teachers would say it's going to take 5 years out into practice before you really own the adjustment and you own the principles and philosophy of chiropractic. Awesome. It doesn't have to be that long, but it certainly can take a long time to feel really comfortable in your skin as a chiropractor. You're on your L's, but at some point you will be on your P's as a chiropractor. And that comes about because of the continual professional development you do, the skills you develop and the knowledge that you acquire. When you do that, you become more competent, more confident, and you can go out on your own. Do I necessarily think that that is the best idea? There is a time and a place for it, obviously, but it's not always the best idea because there is always more that you can learn. But the highlight of this video is, look, there's so much for you to learn. Get a mentor. Recognize that your level of mastery will come to the depth of the information you take on board, implement and apply. And I want to finish with one statement because I hear this all the time. If you're at uni watching this, the most common thing I hear from students is, I just need to get through this. No, you don't. You need to get from it. What you put into it, you'll get out of it. If you put into it as little as you can in order to get through, it will show up in your clinical settings. If you take mastery from the day one from your study, you'll own the information, you'll get through the exam, and then when you come to day one, you'll remember it, because I've done this with associates. All right, let's go through the anatomy of the body, and they're like, oh, we studied that 3 years ago, I can't remember it. Well, this is something you're going to need to know when you come to looking at x-rays. These are things you're going to have to remember. Put it into it so that you can get out of it. That's part of your professional development, and that's something you'll do for the rest of your career. Hope you enjoy this. Look forward to the next video.